So welcome to this webinar on older people and food insecurity. My name is Hannah McGurk. I work in the Aging Well team in Public Health in Leeds City Council, and this report has been a partnership between Public Health in Leeds and Leeds Older People's Forum, but we've also sought the views and kind of input from other partners working in the system in different sections around the city, and would like to thank everyone for their involvement in this report. We wanted to identify the gaps in provision for food and food insecurity for people aged 50 plus, help us be more proactive and preventative as a city, as well as tackling health inequalities that people are facing. Next slide, please. Thank you. So this piece of work should be read in context with a lot of other strategies that are on the screen there as well. We do go into a bit more detail in the report, but just to highlight that this is a multi-agency approach with lots of different things happening. And so the report is a deep dive into the impact of food poverty and food insecurity, because we recognise that this population might have slightly different needs, and we wanted to understand this a little bit more. So later on, we'll talk about there's some strategic and operational level recommendations for supporting people to age well and access good food. So next slide, please. And I'll just give a bit of background about why older people's food insecurity matters. So it costs our health and social care services a lot of money. There was an estimate that's on the screen there from 2018 about the cost of malnutrition in older people as an issue, and that this is likely to increase. So that projection was from a couple of years ago, and we know that it still is an issue beyond just the cost. There's also the impact on people themselves. We also know that we have an aging population that's becoming more diverse as well, and it's important that we understand the needs of this group, particularly the different and often complex situations that people may experience in their life and the impact of that on food. And that also includes understanding inequalities, which again, it says on the third bullet point there, and the impact on that for people to have a happy and healthy later life, and the different ways that that might show up for people. Next slide, please. So food insecurity is more than just food poverty. We do explain this a bit more in the executive summary and the full report, but this slide is just to highlight that although food poverty is important, especially with the current economic climate, but for older people, food insecurity might look different. So it could include changes in someone's ability to go shopping or cook food, or the way that they actually eat. It could be life changes, so it could be if somebody retires, or they're recently bereaved, or discharges from hospital. There could be other reasons, or that kind of cumulative or progressive changes. So if people develop dementia or arthritis or dental changes, and that kind of highlighting the complexity, because it could be one or more of these, and what that means for the older person, and just again the complexity of what this looks like for older people and food security. So I'm going to hand over to Jo now, who will introduce herself and then take you through the next slide.
Hi, I'm Jo Volpe. I'm Chief Exec at Leeds Older People's Forum, and I'm really delighted to be able to present on this report on food insecurity. We've included this slide here, which is a really busy slide, but I think it really shows the complexity of factors affecting older people's food insecurity. We have social, physical, mental, attitudinal, geographic, community type factors. We also have issues around poverty, deprivation and income, all those factors listed there, housing, ethnicity, disability, whether you're in a couple or a family, they can all have an influence on older people's food insecurity. And as Hannah talked through just then, in terms of age-related capability and circumstances, things can happen suddenly to older people. They can happen progressively, but all of those things can happen at the same time and be cumulative. So, you know, it's a really complex environment within which we're working when thinking about the factors affecting older people's food insecurity. Next slide, please. So we just got a little bit more there about the factors affecting people's insecurity, and we've broken it down to quite structural factors here. So housing, where people may be asset rich and cash poor. And we know that there's more and more older people living in rented accommodation, and the threat that that has on their income, you know, into old age will be a factor on whether they can afford food. Access to benefits is difficult. We know in Leeds, 2 out of 5 eligible people for pension credit aren't claiming it. We've got a huge amount of money being unclaimed in the city because it's a difficult benefit to claim, but there is support out there. Housing benefits, transport costs, all these costs that can affect how much people have got to spend on food. And actually sometimes digital exclusion can be a barrier to food insecurity, where services become sort of digital first. Some older people find that difficult to access, and it can exacerbate their food security. So next slide, please. The next things that we've listed there, the bottom bullet point there is another infrastructure issue around transport and access to transport, and whether people can actually get to food. And then there's different, food insecurity affects different people in different ways. So culturally diverse groups find it culturally appropriate food more expensive to buy, and there can be cultural stigma and language barriers. People with disabilities, again, we have increased costs for potential heating, medical equipment, specific dietary requirements, all of which affect older people's food insecurity. Next slide, please. And carers, carers in Leeds, their top 3 concerns when surveyed were about their health and well-being, their changing needs for the people that they care for, and their money and cost of living. So we can see that, carers are going without their essentials and are, using food banks increasingly. So next slide, please. So what we've just talked through there forms the first part of our report, which is really the issues that are affecting food insecurity amongst our older population. And then the second part of the report, which we're moving on to with this slide, is what we have in Leeds to overcome those factors affecting food insecurity. And one of those is to take an asset-based approach and working together as team leads, and recognising the importance of the statutory, private and third sector services working together to overcome barriers to food insecurity. We've got the neighbourhood networks, the Leeds Community Anchor Network, programmes like Enhance that work with community healthcare neighbourhood teams as a wraparound support for people. We need to see better work with supermarkets and full cultural food shops, all those assets listed there, and enabling the third sector to make better use of local partners and to address specific needs within those local communities. We think coming together as team leads will make that difference. And now I'm going to hand over to Francesca.
Thanks, Jo. Next slide, please. Hi, everyone. I'm Francesca Wood. I've been contracted by Leeds Older People's Forum to conduct most of the work on this report. And as Hannah said at the top of this, we're really grateful for the generous contributions of their expertise and experience of so many of our system partners and local community organisations and their users as well. So I'm running through some of the key findings, and we wanted to draw out 4 findings in particular, which really speak to that complexity that Jo was alluding to. And that's both ensuring that we put the older person at the centre of the work we do and understand their particular needs, but also as system partners, how we need to collaborate across the city with other partners and networks to make that happen. So the first of the key findings is, of course, the importance of the wider determinants of health as part of this work. And you can imagine in particular things like housing and the local environment are particularly important in that. And as a Marmot city, and with housing as one of our initial priorities, we wanted to make sure we're really drawing that out in terms of thinking of that through for what that means for older people and their food insecurity. The second one is understanding the importance of social support networks to older people for their food security. Again, as Joe had been talking through, whether it's sudden changes to the capabilities of and circumstances of older people, or whether it's that progressive and cumulative impact, the social support networks are so important to making sure that there's that regular contact with older people, that we're getting ahead of any changes for better enabling prevention or early intervention to happen. But also the other point we wanted to make there, because we understand, of course, how much pressure funders and commissioners are under at the moment. And it's often seen as, how do we reduce our services? How might we better use digital by default rather than in person? And we wanted to make that sort of plea for really making sure you're ensuring that that social support isn't designed out of any changes to services that you're thinking about. Those touch points for older people are so important in terms of keeping them healthy and well, but particularly from their understanding their changing food security needs. Thanks. Next slide, please. The other two key findings we wanted to bring out, and we hope we've done justice to this in the report, is really making sure all of our city partners really understand and have sight of the networks and organisations that support either older people or support food security, or increasingly that cover both of them as well. And that's important for everyone from strategic commissioners and funders down to local service providers and frontline delivery partners, and of course for the older people and their carers and families as well. Understanding those networks is our best way of making sure that we are ensuring we collaborate and make the best use of the very limited resources that we have here in the city, given the financial pressures that we're all experiencing. And it helps us to minimise duplication as well. The final finding we wanted to just pick up on is understanding the needs and barriers that specifically relate to older people. So again, this was what Joe had described, and we wanted to make sure that we're really considering those, whether you're directing policy and strategy, or whether you are designing a programme for delivery, or actually one of the frontline members of staff. We also, again, want to make that plea for please think about the complexity that we've discussed and covered in this webinar, but also in the report, because it has such knock-on effects and for the interdependency. So if you're looking to fund something or reduce funding or disinvest, please think about the knock-on effects that has for some of the critical factors for food insecurity for older people. And that really covers across the public, private and third sectors as part of that. Thanks. Next slide, please. What we've tried to do on a page is distill what we have found through the report. So moving from the left-hand side across to the right-hand side, if you want to address this, if you want to address older people's food insecurity, which includes food poverty, then you really need to consider these particular barriers and issues, all of which mean something quite different for older people than they may mean for other groups that people may be used to supporting and dealing with. And particularly, they include those changes in age-related capabilities and circumstances, whether those are sudden or whether those are progressive. And you need to consider those across the factors that are at the bottom of that slide as well. And lastly, it needs to be done in collaboration across these system domains as part of an age-friendly city as well. So we appreciate that is a lot to get your head around and to keep in mind, which is why the report goes into detail about what these actually mean, what they mean for older people, and some of the assets and good practice we already have that exists that shows how that can be done well. Thanks. Next slide, please. So I'm going to finish up by just running through some of the strategic recommendations before handing back to Jo for some of the more specific recommendations. There are a number of recommendations in the report, as you might expect. They are all really based on making sure we understand the needs and barriers that specifically relate to older people and food security, making sure that's taken into consideration, regardless of which aspect of team leads you're a part of. And improving that infrastructure of support. We hope that the report really does show how important and how lucky we are in Leeds with the infrastructure we have. The more we can do to support better communication and coordination, the more effective and efficiently we can use the resources that we have. And lastly, as you'd expect, there's an awful lot of recommendations about improving access to data. As part of that, we're making sure we have some very specific recommendations for that. But again, in terms of improving our collaboration and understanding, that access to data and the quality of the data is particularly important. Thanks. I'll hand back to Jo.
Thanks, Francesca. So I wanted to finish on drawing our attention to some really specific actions that together in Leeds I think we could work on, and that individual teams can really help drive forward. So I think, you know, financial inclusion for Aging Well has got to be our top action to really work on together and improve pension credit uptake as a gateway to other benefits such as winter fuel payment, transport and that infrastructure support to enable older people to be independent and do their shopping themselves, but they need access to transport to get to food outlets, and digital inclusion work with digital teams to upskill people to use technology, to do online shopping, and again to remain independent. We need to work together with age-friendly spaces and communities, encouraging where we live and where we shop and where we might go for food, to think about older people and their offer, and also at the same time understanding food deserts and where there are food insecurity gaps. And then finally, there's an ask around funding to overcome barriers on food insecurity. And I think if we can work together as a team in Leeds and each take responsibility for where we can make a difference, then this report will have achieved everything that it wants to in terms of how we can overcome barriers to food security for older people in our city. Next slide, please. So we've talked a lot about the full report, and that is available on Leeds Older People's website, and there's a link here within this presentation, but if you search Leeds Older People and food insecurity, you will find it. There'll be more resources on the Public Health Resource Centre, and within the report we do link to various different resources which will be really helpful for older people, which will be helpful for professionals working within this area. And if there's anything you want to talk to us about at Leeds Older People's Forum, if you think you can be part of helping make food security better for older people in the city, please do use one of those mechanisms and get in touch with us. Let us know what you're doing and how we can help and work together. And thanks very much to everybody that's been involved.